This is the last video this is the introduction of our system. This is the last of it. Why you should come to us, why you should come to Turkey. I know that there are some misunderstanding or misinformation about the country, that I can assure you that if you are coming to our system or the country, we will treat you by the best. We will protect you, your rights and whatever in these viral days, the COVID-19 days. So I know that in USA and the vaccination is going to be completed very soon. But in Turkey, we are doing the same, a little bit late. But we will be just starting our system or the providing our system to the USA citizens or whatever, the people who wants to be treated in Turkey. So we will be starting our, the protocols or the system after the September. Now we are just introducing our system to all over the world, not only to USA, but you are welcome. This is the best aim of our, companies to attract more people from USA. So what we are going to do to you, if you have a problem, so we could ask you to correct your brain-body imbalancing using the, whatever the psychological, but it's not the psychological. Psychological, you don't have to be named as the psychological disturbed people, but this is something, because you want a baby, you are in stress. And you have to get the information and to balance your mind, balance your body using whatever needing, and you have, I know, in USA, you could find it. The second one is just we will ask you to find out what is the sperm conditions. And your partner or the male side can have the, decreased sperm counts, morphological problems. Even if you don't have any sperm in the samples, or you could have some kind of testicular sperm extraction, and there would be no sperm found. So I can tell you that. We have some remedies for each of them, and we have some system to select the best DNA sperm with using some kind of, the new microscopes or some chips, and to find out or to select the better sperm to be injected into the oocyte, and at the end, fertilization is good enough, and good embryos, good pregnancy. And I can tell you that we have a new system, and we have some data in our hand, because there are some cases, and even if two or we don't want the three of them, but there a male can have some operations, and they could be not found any kind of sperm in the samples. They say there is nothing to do. And we have a new system for the microscopic sperm extraction from the testicles, and we could assure you that we could find out up to 30% sperm, mature sperm in the samples, even if they have 2 failed previous attempts. Then other new things for you that you could find it in your, Google or whatever. We are just using the round sperm injection. It's a new thing. We have some experience about that, even if there would be no sperm, mature sperm found in the samples, and we could find out some elongated sperm, and also maybe we could find out the round sperm, and we could select it under the microscope, which is not easy, but we could inject them into the oocyte using the piezoelectrical, system to activate these sperms to fertilize the oocyte. And we have few pregnancies out of that with don't say that we could use it for every patient, but with the zero pregnancy, we could go to up to 18 to 20% pregnancy in the proper cases. For the people, and we could select the right eggs. We don't want the drugs to be used for the individual, so we don't want to use too much, we don't want to use too less, and we want to use the proper dosage. Another very important thing is, especially if you have the decreased ovarian reserve, because it could be happen in the young people, and so we could diagnose it, and we may be using new things like PRP system. So it is a new technology, and we could get your blood and to select the thrombocytes from your blood, and we could activate it with some new technology depend upon to your the information, and we could have the plasma out of that and to inject into your ovaries, and we have the data, and there is new published with in USA. Go to them and to see, because if we correct the problem in the environment of the ovaries, and we could get sometimes more eggs and better eggs to be injected with the proper sperms and to get better IVF results, and also some of those patients or the ladies can achieve spontaneous pregnancy. This is very important. And we may be using some genetical testing, we call it pre-implantation genetic diagnosis, to find out the better embryos. But importantly, I tell you that when you have 2 or more IVF failure, even if they are saying to you that the embryos are good, or if you are having the PCO, polycystic ovarian syndrome, if you are having the endometrioma, if you are having some kind of immunological problems, so the endometrium could be not good enough to be receptive for the embryos to reach the pregnancy. So we have new models, and we are just using some kind of techniques, and we could use some substances to inject into the endometrial cavity, and we could use the PRP technology for supporting the endometrium. Most importantly, we are just using the PMSD model, which is we could get your the blood, and we could culture it, and during the culture of the monocyte, and we may increase some substances in the culture system which could support the endometrium for the pregnancy. And we may be using this, the cultured media into the endometrial cavity just before the embryo transfers for the 2 days or 1 day before, and we could support let's say, if it is the balanced embryo, and we could balance the endometrial cavity, and we could have the better pregnancy results, even if the previous failure cases. So we could tell that, we have some kind of, the new ideas, and we publish them, so to help you to achieve the pregnancy. If there is an imbalance any area, including sperm, brain, oocyte, ovary, and the endometrium, if it is needed. So if it doesn't need, we are not going to use. Sometimes too much is too much, which could decrease the pregnancy. Sometimes less support can support you to reach your healthy pregnancy. So what I'm saying is, this is a very serious area. It needs the expertise, it needs the technology, it needs the responsibility, it needs the, a kind of law. and going together to the target. We are here. We want to meet you. Even if you cannot come, we are happy to give you some direction and the information to feel better. If you feel better, if you get enough information, you will be ready for the treatment. You will be ready for the pregnancy. See you soon with the different videos. So I'm going to go deeper into the information, and I will be waiting to get your questions to design the video, let's say the videos from now on. Thank you very much.